Good evening. My name is Dr. Ali Cemal Yılmaz. I come from Fatih Sultan Mehmet Research and Education Hospital. I am delighted to be with you. Well, our cosmetic practice, although we do the same process, does not give the same result. That's why we have to develop ourselves and our technique. But most importantly, our material is human being, and we forget this. The psychological situation of our patients definitely impact the results. That's why the selection of patients and psychological support actually improves our results. Human beings, they always have a desire to look good, and reconstructive experiences that we gained during the world wars actually have improved. For instance, between 2003-2007, cosmetic practices have increased by threefolds. In 2014, 40 million practices have been done. That's why it is an important part of the market economy. That's why it is prone for exploitation. And there are beauty salons that only have a certificate, and there are massage centers, spas, and body development centers, unfortunately, which are not experienced. And today, people's perception towards their body has changed. Now the body is an accessory rather than an anatomy, which is actually a raw material which is continuously shaped. Now body is no longer the fate of a person, especially with divorce, separation, losing an acquaintance, or the ones whose life conditions change. Whenever they change their body, they think that they would also change their life, and they have Botox and also hair implant protheses under the skin, and also fillings. Unfortunately, they all increase the deviation between people's spirit and body. Cosmetic surgery psychology studies were first conducted in the 1940s, and in this study, most of the patients were neurotic and narcissistic. According to the study, the biggest study was carried out in the 1960s. And in this study, the pre-operation psychological situation and post-operation psychological situations were evaluated. And the studies carried out actually most of the studies were carried out in a clinical level, and the evaluators, the researchers, objectively actually diagnosed patients, and 70% of the patients in this study revealed neurotic depression and passive dependency personality disorders. And the disadvantage of these studies that they couldn't come up with a uniform diagnosis. In psychometric evaluation, psychological disorder was less found, and in MMPI operations, no psychological disorder was detected, and the sampling of such studies was lesser. And psychology, after the operation, many speculative studies of how patients were impacted was carried out, and there were 10 studies. According to 6 studies, patients benefited from such operations. In 2 studies, they were negatively impacted, and in 3 studies, there was no change in the psychology of the patients after the operation. Most of our patients do not like their bodies, and the problems of the patients become our problems as well, because a body actually is an important factor. Trash and Buzansky have recommended cosmetic surgery because it supports psychologically the patients. Herberg in 1996 classified body image psychological effects in 3 groups: perceptual, developmental, and sociocultural. The person cannot position himself in the space, and this has got nothing to do with psychological surgery. Their complaints are different, and their statements actually differ in time. Development impact. During childhood and adolescence, actually, this is developed. Humiliation and mocking actually during childhood, like for ears and teeth, for instance, they have an impact. The sociocultural. This group has, for instance, has patients whereby they compare themselves with Hollywood stars, for instance, and they increase their interest to such surgeries. The body image has reactional impact based on the feeling. The cosmetic surgery differs. The ones, some people, even though they don't like some certain parts of their body, they do not apply for a plastic surgery. There are people who are not satisfied with their body image, a part of it, and they stress about it, but they don't have any dissatisfaction about the rest of their bodies, and body image dissatisfaction. Their daily activities actually deteriorate, and they camouflage their bodies, and they come and ask for cosmetic surgery. Body dysmorphic disturbance is classified in DSM-5. It's an advanced body image disorder, unrealistic. Image leads to anxiety, and it is difficult to control this anxiety. People become introverted. Scratching, looking into the mirror are different behaviors that are displayed. Anxiety is developed, and in cosmetic surgery patients, the prevalence is 6 to 7%. In another in dermatology clinics, this rate goes up to 12%. Previously, there were patients with this disorder, and the recent studies reveal that this patient group is being classified moderate and severe. And moderate patient group can benefit from such surgeries. I had 2 patients as such. I don't know what patients felt, but they had anxiety. They seem to be non-compliant, but actually they are compliant. They only want an operation, and they actually very value people who support the operation idea. A patient, even though he had many operations, abdominal operations, to uplift his belly, he again came to us time after time having a complaint that his belly, abdominal area was itching. Now I do not follow up that patient because I refuse to perform another surgery with him.
Before cosmetic surgery, the psychiatric problems are leading us to perform the surgery, and after the surgery, sometimes psychiatric disorders are emerging. But after the surgery, the self-confidence is increasing. Hypothalamic and in the adrenaline glands, psychological problems are having an impact. The wounds are not treated, then the CRP will definitely be the center of those two systems. And CRP at the same time will increase the cortisol level and it will activate the sympathetic nervous system. Stress in the recent times has been shown to be delaying the wound care, and the students in the examination time will definitely delay the wound healing. Bad sleep, alcohol consumption, lack of exercise and the smoking will delay the wound healing because of the stress. Another important complication of the wounds might be seen from our slides, stress and keloids. It will increase the CRP release and then through the sympathetic nerves the keloid will be formed. In an inert skin, the wound healing will be delayed as well. In stressful conditions, the skin tumors will be also formed. Then alopecia areata will be developing. These patients have many psychological treatment and it will be quite important to treat those patients. In the acute phase, there is no place for cosmetic surgery. Fat injections might be done to the patients. Sweating is indeed providing social avoidance. Vasoliposuction might be performed on those patients. In conclusion, psychiatric disorders are evaluated differently. Plastic surgeons are using SIMO criteria: single, immature, male, excited narcissist person. When we have them as patients, we are much more careful. The patients with whom we cannot communicate and the patients who are asking for heart surgeries. Even in the cases of diabetic feet, in such complex cases, we are trying to treat those cases. Thank you very much.